Hello, everybody. Thank you for joining us again for part 2 of our NMD training webinar bootcamp. This webinar today is going to be focused on NMD data submission and reports. And here are the learning objectives for today. This webinar is going to be focused on helping you recognize how your data can be used for facility benchmarking and quality improvement. We're going to explain the connection between entering accurate, complete, and timely data for maximizing the value of registry participation. And we're going to explain how to upload complete data into the NMD and resolve validation and rejection errors to help you maximize the value of your participation. You might remember me from last week's webinar. My name is Zach Smith. I'm the Senior Quality Programs Assistant with the ACR's Quality and Safety Department, and I'll just be helping to run the webinar and administering some polls to get some feedback from the audience. Once again, we're joined by Dr. Robert Rosenberg. He practices mammography for Radiology Associates of Albuquerque. He's a fellow of the Society of Breast Imaging and currently the chairman of the ACR's NMD committee and the chairman of the National Mammography Quality Assurance Advisory Committee of the FDA. He's professor emeritus from University of New Mexico Department of Radiology and a former principal investigator with the Breast Cancer Surveillance Consortium, an NCI research group. And again, we're joined by Gretchen Maris. She's a data analyst for clinical radiologists based in Springfield, Illinois. She has a degree in healthcare informatics and has worked for clinical radiologists since 2008. The main part of her duties with clinical radiologists involves managing and completing all ACR NRDR registry submissions for 29 hospitals, 2 multi-specialty clinics, and 1 imaging center, all serviced by clinical radiologists and their 79 radiologists. Also joining us for today's webinar, we've got 3 members of the ACR National Radiology Data Registry staff. We've got Lou Meyer, Senior Quality Program Specialist, Ryan Kiefer, Associate Quality Program Specialist, and Mike Simanowith, who's the Directory of Registries for ACR. And none of our speakers have any relevant financial disclosures. Just a reminder about how to log in and get to your audio. Hopefully everybody's already hearing us correctly, but you can switch either between phone audio or computer audio. If you're on computer audio, you should just be able to hear us straight through your computer. If you're dialing in by phone, you'll want to call the number under your audio tab and also enter the access code and then enter your audio PIN. We also just want to remind everybody that we'll be answering questions via chat for the webinar. So if you've got any questions, just go to the questions tab on your GoToWebinar panel. You can ask us there and we'll respond to you as quickly as we can. We'd also like to start by just polling everybody really quickly to let us know if you attended the part 1 webinar, which we had last week. So let me launch this poll really quick. I'll give everybody a little bit of time to fill that out. Okay, thanks everybody. It looks like about 68% of you were in attendance last week, and about 32% weren't. So welcome to all the new people. Thanks for joining us this week. And with that, I'll turn it over to Dr. Rosenberg. Thanks, everybody.
Welcome, everyone. Glad we have a lot of people back. Hope the first one was helpful and this one as well. So these are a couple of, I think, useful quotes about what the audit is about. It's about understanding what you're doing, and it is important. I don't think we know how well we're doing unless we do something of this sort of an audit, get feedback, and you can look at it positively. If you're doing great, that's important. And if you're doing not great, that's important to know too. That's more the Ann Landers comment. Next slide, please. So the NMD reports, it's important to how the data is used. And what's critical, and we'll talk about in this one, is getting good data submitted. Unless your data is complete and is accurate, the reports that you get out will not be that useful. And it won't be useful to ACR as well. Remember, the data you're using gives you feedback about some accuracy information, and it's used for comparison information. So it's helpful for others to see where the community lies on these measurements. And again, we'll talk about report management, report uses, very important stuff that you'll interface with the ACR staff. Next slide.
Hi, everybody. This is Gretchen. Some of you might have been with us, obviously, on the first webinar in this series, so this is going to be familiar, but I would like to address the newbies that are here. I want to introduce everybody to the NRDR knowledge base, which is pictured right here. The knowledge base can be accessed several different ways. One way is obviously the link to the address right there at the top. Another way is from the bottom of the sign-in page for the NRDR. If any of you all are familiar with signing into there, all the way at the bottom, there's an NRDR support link that you can click on, and it will take you here as well. The knowledge base is a knowledge warehouse and a learning tool for all aspects of our registries included in the NRDR. As some of you might remember, in the past, the NRDR had separate user guides for each different registry, the NMD, GRID, MIPS, and the portal. And now all of those have been combined and made available to you into a single user-friendly online searchable resource. The knowledge base contains general and specific information regarding the NRDR. So when you search for a topic that you have a question on, you use the search bar right underneath how we can help you today, and you type in your question. And it doesn't have to be a full question, it can just be keywords. Once you click search, the search function matches what you have typed against the content in the knowledge base and the titles of the articles in the knowledge base using those keywords. Then you can click on any of the results, and once you've read through the information that's provided at the bottom, you're asked if that information is helpful. Please take advantage of the chance to rate the information that's been provided. By clicking on one of those answers, either yes or no, you will be assisting the ACR in making this knowledge base even more powerful. If you're unable to find the information that you're searching for, it's suggested that you go ahead and create a support ticket using that new support ticket link that's to the right of the search bar up there. And then someone with the ACR will contact you and assist you with the issue that you have typed in. Next slide, Zach. So now we want to ask another question. We want to know how familiar everybody here in the audience today is with the NRDR knowledge base. Whether you use it often, occasionally, rarely, know about it, but have never used it, or this is the first time you've heard about it. And then I'll let Zach analyze all this for you.
Sure. Had about 60% of people responded so far. And just a reminder, this is, we're calling it the NRDR knowledge base here. We also sometimes refer to this as fresh desk. So if you're familiar with that term, maybe some people have used it and just don't know that they've used it. Okay, it's about 70-some% responding. So it looks like about half of the people know about it, but have not used it before. And about 39% have not heard about it. So that's an improvement from last week where quite a few people weren't familiar with it at all. So thanks, everybody. And now I think we're turning it over to Ryan. So I'm going to switch presenters real quick. And Ryan's going to do a live demo of how to use the knowledge base.
Thanks, Zach. So just to give you a brief overlook in terms of a couple of different additional places where you can go aside from the URL that Gretchen provided. If you are an NRDR user, and if you go down to Quality Improvement Registries and NMD, you'll get this information here that goes into about the NMD, and that, excuse me, that also takes you to the knowledge base as well. And even if you're not a user, we actually have it linked in on our website. So if you go to practice management, quality, and informatics, and then to data registries, and to the NMD, and if you go down here to the core documents section, the features of the National Mammography Database will take you there as well. And to reinforce what Gretchen had mentioned, this is, we're always updating, we're always adding content for the registries, not only for NMD, but for our other registries as well. But we're going to focus on NMD for obvious reasons here. Submitting data to NMD, which we're going to get into in a second, and NMD reports. And if you go into NMD available reports, this shows you the type of reports that we put out. Those can be done on a quarterly or a semi-annually or an ad hoc basis. And then there's sample reports down here that you can go ahead and review as well. And if you do need to reach us, you can click on New Support Ticket and type in the information that you'd like. When sending in a query to us, please do not include any sort of sensitive or PHI in the ticket. This is not a encrypted application, and if we do need to ask for PHI for any sort of issue, then we'll certainly go ahead and request it and work around any sort of ways that would compromise your data. And let's see here, and if we can go ahead and go over to the next slide, Zach, whenever you're ready, and take control back from me.
All right, there you go.
All righty. So the type of options to submit data, if you've went through part one, we discussed this a little bit, but we can do a batch or or what we call a flat file upload, and those are done a couple of different ways. You can use software that's NMD certified and includes a variety of vendors that have gone through the certification process with us, or you can use other methods like Excel. We actually can use a text file for uploads if you prefer. We've actually kind of made the process a little bit simpler as well. So when it comes to uploading a file, if you see down there in within the NMD registry, if you go to data collection and upload data, and you'll want to go ahead and locate the file on your computer that includes the data, and then click upload. Those templates that or those XLSX files that you see there, those are actually templates, Excel templates that we've actually created that our IT department has approved, that you can actually go ahead and download and use to upload the data as well. Next slide, Zach. The options to report data also include web-based data transmission. You would actually go ahead and submit a query to us to go ahead and get that process started. If you participate in any other of our registries, such as the lung cancer screening registry, that also has a web-based solution. So the good news is getting NMD online is pretty easy. It is if you also participate in our dose index registry. The process is somewhat similar, but it's a pretty easy process to do. And we'll go ahead and go with the next slide. And I'll go ahead and turn it over to Lou.
Let's make sure we might have Lou on mute there. You there, Lou? Sorry, give us just a moment here.
How's that? Can you hear me?
There we go. Thanks, Lou.
All right. So how often should you submit your NMD data? You can do it as often as you'd like, but you should submit your data at least every quarter in order to take full advantage of your aggregate reports, which are published quarterly. The deadline for submission is the last business day of the month following the end of the quarter. For example, we're now in quarter 3, which includes July, August, and September. Since the quarter ends in September, you have until October 30th, that is the last business day in October, to submit your data. All data successfully submitted by October 30th will be included in the quarter 3 report. This gives you at least 1 month to gather pathology results from your quarter 3 exams. If your pathology results aren't complete by the reporting deadline, you should submit what you have and resubmit the completed records when you can. That way, they'll be included in the next quarterly report. We strongly recommend not waiting until the deadline to submit your data. After you submit your data, you should use the Data Quality Report to see if they look like what you expect. This is a new report that we've just rolled out, and I'll be talking about it later on in this presentation. If you see something suspicious in that report, or if you have a lot of rejects, you may not have time to fix them if you wait until the last minute to submit your data. There are advantages to submitting data more frequently than once a quarter. If you're new to NMD, you may encounter format or data issues that cause records in your file to be rejected. You should submit your data frequently until you're fairly sure that your uploads will be error-free. As always, we're here to help you with those issues if you need assistance. Also, we're working on an interactive version of the aggregate report. Data for that report will be refreshed weekly. So once we have that in production, you'll be able to track your performance measures on a weekly basis if you upload your data weekly. When generating your NMD file, it's important to use a time frame that includes updated records. If you suspect that there have been updates to exams from prior quarters, you should use a time frame that includes those exam dates. It doesn't do any harm to resubmit records that haven't changed. They will simply overwrite existing records in NMD with the same values that they had before. Since performance measures are recalculated every quarter, your updates from previous quarters will be included in calculations for the corresponding year. For this reason, we recommend that you upload the last 6 months of your data routinely to make sure that you've captured all updates to your follow-up data. Now I'll hand it back over to Ryan so he can tell you what to do after you upload the data.
Thanks, Lou. So one of the first things that you'll discover as you're uploading data is that the process is generally an instantaneous one. So for instance, if you were going to go ahead and upload data as I outlined earlier, and it would reject, such as that second example below where all the records rejected, you'll actually receive a message that says all records were invalid, or if it's a partial acceptance, you'll get a percentage breakdown in terms of what how many records were accepted, or how many records were added, I should say, or added with warning. And those links on the right-hand side will show you whether or not you can go ahead and delete the log file, delete the data file, download the log file, show the log file, or view details. If you do view details, that'll actually give you a breakdown in terms of how many records came through if you've done a upload for multiple facilities. If you download the log file, or actually if you show the log file, that'll actually go ahead and show you in a new browser window the errors in any sort of record that you would see there. And along those lines, if you're going to go ahead and do show log file, you want to make sure that pop-ups are enabled for the NRDR portal. When you download the log file, it's actually going to download into an Excel format that's going to look an awful lot like the Excel template that is available that you can actually go ahead and use. So you can actually go ahead and download the log file and make any sort of notations to the records or any sort of corrections to the records that were rejected or that were shown as incomplete. And you can actually resubmit that log file as a file submission. You just need to rename the file appropriately. Next slide. So some of the issues that we get when it comes to uploading the data are any sort of rejections. You'll see there that the breakdowns in terms of what was valid, what was invalid, and then you can go ahead and click on show log file or download log file. On occasion, you'll get not a rejection per se, but it'll say valid with warning, and this usually goes around if any of the physicians at your facility or at your entity are missing an MPI as part of the file submission. And we ask for MPI because it's if you were to go ahead and report MIPS data for those physicians, we can actually use that as a feature for you as well. So if you don't include the MPI for a radiologist, what the system will do is it'll go ahead and create sort of a shell record for you, and then it'll say valid with warning, and it'll show you there in the example that that MPI does not exist for this facility ID / registry. So you want to go ahead and include the MPI, and then you can go ahead and resubmit that record. And what will happen is that the MPI will overwrite, in this case, 319 for the MPI, and everything else will remain the same. It won't duplicate. It'll just overwrite what's already existing in the system. Next slide. Another thing that we come across is file format not matching the file version indicated. So sometimes we actually have several different file versions now, so if you're missing one of the data elements, you'll sometimes get that error where it's an unknown version number, or if you're putting in too little or too many elements for the version that you'd like to submit, that will come across as well. Another issue that we'll come across is, and this usually occurs at the beginning of the calendar year, is uploaded data not showing as submitted on the dashboard. And the reason for that is pretty simple, because the dashboard that we have when you log on as an NRDR portal user shows you the data submission for the calendar year. So using this screen grab below as an example, what this means is this ACR test facility has submitted NMD data for this calendar year, but hasn't submitted anything for 2020 for the other registries. You may get that overlap when you're submitting, for instance, exams in, say, January of 2021, and your exam data is covering 2020. That would be the reason why the dashboard would look a little bit strange. We're talking about calendar years for exams, not calendar year for when the exam was submitted. And I think that's all from me. So we'll turn that back over to Lou.
Thanks, Ryan, for explaining what to do about data that get rejected by the system. But what about errors that don't get rejected? For example, what if none of your follow-up data got entered? It's perfectly reasonable to enter a record without follow-up data. So if your records don't have follow-up data, they won't get rejected. You wouldn't know about the oversight until you looked at your quarterly aggregate report and saw that none of your performance measures requiring follow-up data were calculated. The interactive NMD Data Quality Report is a new report designed to help you detect such issues before your reports are generated. We just rolled it out a few weeks ago, so we highly recommend that you check it out if you haven't already. This is available a day or two after each of your uploads. It gives you counts of different data elements in the uploads so that you can see if they correspond to what you expect. For example, checking the record count by classification and malignancy type would warn you of a situation where you didn't enter any follow-up data. The first box on this slide shows a count of indication for exam, where you can make sure all your screening and diagnostic exams got reported and that the distribution of assessments is reasonable. You should also check the record count by NPI to make sure that all your physicians got reported. And by checking the first and last exam dates, you can make sure that you selected the right date range. The second box on the slide shows a bar chart that is helpful in identifying gaps in exam dates, which might indicate that exams for certain dates didn't get uploaded. Next slide, please. The data quality report shows errors that aren't considered significant enough to cause a record to be rejected, but may prevent the data from being included in certain measures. On the slide, in the error detail box, we have the example of a cancer where the malignancy type is DCIS, but the stage indicates that it's something other than DCIS. Since we don't know which is correct, the 4 records in this example will be excluded from measures that need to know the malignancy type. Also on this slide, we see counts of optional data elements. Leaving out these data elements is probably not critical, but it will prevent you from comparing this information to other facilities. For example, this facility is not reporting tumor size. That's acceptable, but they won't see anything for their facility when they look at the section of the report that compares tumor sizes among facilities. It's also important to look at the number of records that are reported as unknown. This facility has submitted 18 records where the lesion classification is unknown. This may be cause for concern because without the lesion classification, we can't include those records in the performance measures. Maybe there was no lesion and the person entering data put unknown instead of leaving it blank. Or maybe there really were 18 lesions where the classification is unknown and they'll be updated later. Or maybe these are data entry errors. Timely analysis of the data quality report will give you time to answer and resolve these types of questions before the quarterly reports are published. Now, we'd like to take a poll about your experience with the data quality report.
Okay, so we'd like to ask everybody if you've already accessed the new interactive NMD data quality report. So let us know if you haven't accessed it yet, if you've looked at it for the first time, or if you've looked at it more than once. We'll give that just a little more time. Thanks for the responses so far. Okay, so thank you everybody. For the most part, our attendees have not viewed this report yet. We have a few people who have viewed it for the first time though, but 94% have not yet. Okay, thank you. Now we'll turn it over to Mike.
Thanks, Zach. And can you hear me okay?
Sounds good.
Okay. Once you've entered all your data for a quarter, then we take that data and are able to aggregate it in a variety of ways and provide back reports that you can use to perform quality improvement or compare yourselves to other participants within the registry. Broadly, there are 2 types of reports, either a facility level report or a physician level report, and simply those are the different levels or comparisons that can be done. So the facility reports compare one facility in the registry to others or to all the facilities within the NMD registry as a whole, while the physicians do the same thing or similar thing, but at the physician level. I'll talk briefly about what the group report is. Each of the facility and physician have a flavor of report that's at the group level, and we'll talk about that in a second. And then also some future reports, more interactive reports that like the new quality report that we will hope to be rolling out in the near future. Next slide, please. So as I believe Ron, I think actually Lou mentioned, reports, the data is collected every quarter, and then you have a 1-month grace period to get any additional information to enter into the registry. Roughly 1 to 2 weeks after that, your reports will then be posted to the Near Dear portal under the facility management aggregate reports navigation on the left. When you click on that, all reports for all registries and all facilities that you are a part of will be posted in this window. And it may require you to do some filtering. So if you actually expanded that little plus sign, if you see that next to the filter, there's a dialog box there that you can filter on a variety of parameters, one of which would be the registry. So you'd obviously want to look for NMD. You can also filter on the facility. So if you're looking at for a particular facility, you'd want to put that facility ID in and search there. So there may be, depending on how many registries and how many facilities you have or you're part of, this list may be quite extensive. So you may have to do some filtering. But this is where your quarterly report will be posted. You'll then be able to click on the download to access that report or access the report. In addition, each quarter when we've made that posting, we will send out a mass communication alerting you that the posting has gone up. So you don't have to remember when it's going to be there. We will send you an email to let you know. Here is a screenshot or a sample screenshot of what part of the reports are. This is for the facility screening report, and within the report, there are various tables and graphical representations of key measures that the NMD committee has deemed are valuable for NMD, for mammography treatment and quality improvement. For the facility, you are compared against like facilities that you have designated in the facility information. And that's in this first table here. You can see this facility is a suburban facility, and in addition to, suburban community facility in the Midwest, you also are compared to the overall NMD. And then each facility that has designated themselves, if you're in the East, this graph will be different for you. It's based on what you have your site has designated themselves in their facility information. On the knowledge base, as Ryan showed, there is additionally a link to a sample report that you can see what is in each of these reports, as well as an explanation of how to interpret the report. The second slide, the second graph on here is the facility group report, and the group report is very similar to the facility, with the exception that instead of comparing one facility to the NMD or like facilities, it compares facilities within an entire corporate structure or group against each other. So in this graph, you can see the different colors are different sites within a corporate structure, and you can see if there's a particular site that's performing better, performing worse. Get ideas from the higher performing sites on or what they're doing, and maybe extend that across the corporate structure or to the lower performing sites. But in essence, the group report is very similar to the regular facility report, with the exception of its comparing multiple facilities within your corporate structure. I don't know if that's cut off at the bottom, but that was just an example of the time frame for when the reports are posted. You should get that in the slides later on if you can't see that. But basically, as I mentioned, it's 1 to 2 weeks after the submit period is over, that 1 month grace period, when you'll see those reports posted. Next slide. The physician report, again, very similar to the facility, only now we are comparing at individual physician levels within your site. You'll see the NPIs listed at the bottom of the graph on the right. Each physician will also have a table with their performance on the various metrics included in the report. And then the group report does the similar thing, except for it is all the physicians within the group, not just within one facility. Again, this is published or posted in the same time frame. There are times if we have a challenge with running the report that we might post one before the other, but typically all the reports will go up at the same time. I mentioned the interactive reports. As of now, the only interactive report is the quality report. However, we are beginning to work on interactive reports for the aggregate measures. And the benefit of that is hopefully they'll be more real time. We can typically update those a day to 2 days after data gets posted, as opposed to the quarterly reports that we currently have. So that obviously is more timely data. Also, the interactive reports allow for data filtering, so you can do some custom filtering on date ranges. You can also download the data typically to Excel text file and do your own local analysis of the data if you want. So be on the lookout for that in the next, hopefully before the end of the year, next couple months. I think that may be it for me. Next slide.
Okay, so we'd like to poll everybody about how frequently you review your NMD reports. So do you review them annually, semi-annually, quarterly, more frequently than quarterly, or never? Give everybody a little time for that. Okay, that's a little over 50% of people responding, so I'll go ahead and close that poll. So it looks like quite a few people, about 55%, have never reviewed their reports. We've also got quite a few people that review them quarterly, semi-annually, or annually. So thanks everybody for your responses.
So when you get your aggregate reports, they might not show the results that you expect. This could be due to a number of reasons. For example, your exams could be underreported because some of them were rejected during the upload process. This also happens when we don't get your exams in time to include in the report. As we mentioned a couple of times in this webinar, we have to get your data by the end of the last business day of the month following the end of the quarter. You have to get us March data by the end of April, June data by the end of July, and so on. You might find that certain measures have a low or even 0% rate. This is probably because we didn't get pathology data from you or they were incomplete. Positive predictive values, cancer detection rate, positive biopsy rate, and others all require complete pathology data in order to be calculated accurately. If you see that the number of cancers is somewhat lower than what you expected, it could be due to a couple of things. First, the cancer has to be detected within a year of a positive screening exam in order to be counted. Sometimes we investigate questions about this and find that the year window had elapsed before the cancer was detected. Second, the cancer has to be associated with a positive screening exam. If the patient's screening exam was assessed as negative or benign, we won't count any cancers associated with that patient, regardless of when they were reported. Another thing to keep in mind is that the report has two sections, one for the current year and one for the previous year. The cancer is counted in the section that corresponds to the year that the screening exam was performed, not the year that the cancer was detected. So, as you can see, there are a number of reasons why your report might look different from what you expect. But if you don't understand why, we're always here to help you figure it out. Now, I'll turn it over to Rob.
So as Lou was explaining, the reports you see from NMD may be different from what you're expecting, which is what your vendor calculates. And again, there are a number of reasons for that. Incomplete data uploaded. Sometimes there's issues with how the report is formatted and what's included. Date range has to be the same. And again, the information will be made more complete over time, so the information may not be the same. Issue of satellite facilities. Did you do your report based on the same set of facilities that your NMD report is based on? Pathology data will come in later frequently and therefore may not be included in all of the reports. And the vendors sometimes use different definitions. Issues I've noted is that DCIS sometimes is overcounted. Multiple cancers sometimes are overcounted if patients have more than one positive biopsy. Lots of issues. It's important for all of us, both the facilities so you understand the data, and ACR and the vendors so that we all have as accurate and consistent approaches as possible. So when you have problems, again, ACR is may be able to answer the question. Your specific vendor may be able to answer the question. But we like it when these things get resolved. Next slide, Gretchen.
Thanks, Rob. In our first webinar for this series, I spoke a little bit more about the specific calculations that most mammography programs use in determining how their facilities program and their employees are performing. Things such as screening recall rate or abnormal interpretation rate, cancer detection rate, and positive predictive value can be used to evaluate your program and to set internal quality improvement goals above and beyond those that are mandated by the MIPS quality payment program if your facility participates in that. You can also use the data as part of your process in evaluating new and existing physicians. You can identify additional training opportunities and verify the consistency of your operation in comparison to each other internally and to the NMD overall, and all of that information is found in those reports. For instance, again, I spoke about this in the first webinar. Within my own organization, we use that information from the reports on screening, recall, cancer detection, and PPV to determine when we have radiologists that need extra training per an internal corporate policy for quality improvement that we've already set up. The NRDR data is also useful to us for monitoring that overall consistency of our radiologists so that we can determine who needs that refresher course. You can also take both the individual data and the facility level data in the reports that Mike was talking about earlier and use them to demonstrate your mammography program's quality to your other healthcare leaders. Since the comparison of your facilities and your physician's progress is contained within those reports, these reports allow your facility's administration to provide the information needed to demonstrate your program's value and performance in future meetings that could include other medical staff, board members, and even payers. For instance, one of the charts that is shown in some of those reports is this recall rate with the variability. So there's a lot of information that's included in these reports, and it's good information and usable for a lot of different situations. Zach?
Oh, and I was just going to add that where there's variability, there may be room for improvement, but there's room for intramural learning. So depending on what you find, there may be many things that come out of these that you can use to improve the performance and consistency within your facility. Zach?
All right, so that's gonna do it for the content we had planned for today's webinar. I did want to remind everybody of some resources that are available. We've got our knowledge base, like we talked about earlier, the FreshDesk website. So you can visit that at nrdrsupport.acr.org. We're also going to be emailing out an FAQ of questions from today's webinar and last week's webinar. We'll send that to all the registrants. We're going to send a recording of the webinar out too, and we're going to get those posted to the ACR website as well, so you can view them on there too. We'd love for everybody to provide some feedback about the NMD using the survey linked here. We'll send the slides out when we send the webinar recording, so you can click on that link, fill out the survey, and answer some questions for us. And we are planning on having some future webinars, so just stay tuned for more information about what's coming next with the NMD training series. And to that end, we do have one more poll we'd like to ask everybody. This is going to be a check all that apply type poll. We'd just like to know, what topics would you like to see covered in a future registries webinar? I'll give everybody a minute to fill that out. Thanks for the responses so far. I'll leave that open for about 10, 15 more seconds. Okay, thanks everybody. It looks like a lot of people would like to see all three of those topics. So I guess we've got our work cut out for us. Looks like the most popular two were an in-depth explanation of the NMD reports, and also how to translate NMD data into quality improvement projects. And hopefully we'd be able to provide some case examples there too. And lastly, I wanted to talk again about CE credit claiming. We had some questions about that last webinar too. We'll send the instructions to you by Friday, September 4th. Those are going to come from LeCount@acr.org. That's Alexis LeCount, our CE person here at ACR. So when you get that email, you can click on the link and follow the instructions to claim your credit. You just have to complete an activity evaluation, and then you can receive your certificate. And so all of those credit claiming requests have to be completed before Wednesday, November 26th. 2020. And if you have any questions about that, you can email Alexis at alexis@acr.org. I know we have about 9 minutes left until the top of the hour, so I don't know if we wanted to maybe read some questions out loud. If any of the other organizers have gotten any questions in the question box that they think would be worth addressing here, maybe you could call that out.
Hi, this is Judy Brawlson. There's a question about the charge for use of NMD, and in general, it's dependent on the number of physicians in your group that are doing breast imaging, doing mammographies, and also the number of facilities for which at which they practice. Lisa did send a link out to everybody in the question and answer box, so you can take a look at that. It's also it's in FreshDesk, so you can see the complete breakdown of the fee structure. And then Amy Robinson asked if I think her question was, is NMD mandatory? She said, is this mandatory? I think she may be alluding to the requirement for participating in the lung cancer screening registry, which is a requirement for reimbursement by CMS, but the NMD is completely voluntary. What else do we have here?
There's two more questions here. We've got, how do you check to see what radiologists are in your NMD database?
So if you're, maybe someone else can answer better than I, but if you are a registered user in Near Deer for NMD, if you're a facility user or registry user, you can, you have access to your account, so you can see the, there's a managed physicians and managed physician 10, so you can check that functionality to use that functionality to see if you have a complete list of physicians included under your account.
I would recommend looking at the data quality report that we talked about, because even if you have your physicians listed where Judy just mentioned, that won't tell you whether you actually submitted data for them or not. But if you check the data quality report after each of your uploads, you can do that. And you don't have to, if you don't do it right after, that's okay too. You could go in there and look at the past month or 6 months and see if the files that you intended to use for those physicians actually did populate data for them.
Thanks, Lou. That's a good idea.
Let's see, you have time for maybe two more. Let's see, in the past, I've only uploaded NMD as a full quarter. Would it be best to start loading monthly?
I don't think that's necessary, but it may be beneficial for you, and particularly when we go to the interactive reports. Ryan or Lou, do you have any other comments about that?
No, I think that's really what fits best into your workflow. The advantage, of course, uploading more frequently is that you have more time to resolve any problems that might come up. Whereas if you just upload it quarterly, then you won't know until that quarter if you're going to get a big number of rejects or not for some unforeseen issue.
Yeah, to add on to that for a second, you'd also get more familiar with the upload process and get more familiar with any sort of issues or any sort of errors surrounding the data. We do get a number of people who upload at the deadline, and it's fine, obviously, but there, I mean, with the number of participants within the registry, it's probably best to get ahead of the curve.
And thanks, Ryan. I think I'm going to enter one more question from Amy Robinson. She says they're a small hospital and have 4 doctors that they share with a larger hospital. How would this work? You can over the physician, and I don't know if they're the same group, physician 10, so that kind of depends on that, but you are able to overlap sort of physicians across different facilities. But if you want to send a ticket to Near Deer support, that would be, we can fully answer that question.
Okay, so I think that'll wrap up our Q&A, and with that, I think we'll go ahead and close out the webinar. I just wanted to once again thank our speakers, especially Rob and Gretchen, for joining us on these past 2 webinars. We really appreciate your expertise. And for everybody who attended today or last week, just be on the lookout for any future registry webinars we might have coming up. We'll definitely keep everybody informed of anything we do like this in the future. So thank you all very much and have a great day.
Yeah, and we appreciate the feedback and ideas for the future webinars.